In 2003, imagine 1.4 million people living with HIV in Tanzania, but only 1,000 of them had access to life-saving antiretroviral treatment. These drugs simply weren't available in Africa. If you got sick, there was nothing doctors could do to help, and HIV diagnosis was considered a death sentence. That same year, President George W. Bush announced the United States President's Emergency Plan for AIDS Relief, known as PEPFAR. The plan was conceived to save lives with a specific focus on sub-Saharan Africa. PEPFAR's goal was to get ARVs to people as quickly as possible by partnering with host country governments. The program worked to put strong supply chain systems in place to prevent new HIV infections and to provide treatment to people living with HIV. Since 2003, PEPFAR in Tanzania has provided more than $6.6 billion for the HIV response through USAID, CDC, VRARE DOD, and Peace Corps, and their implementing partners. With ambitious goals from UNAIDS, Tanzania is working towards the 95-95-95 targets to ensure 95% of people living with HIV know their status, 95% of those diagnosed are on treatment, and 95% of those on treatment are virally suppressed. Over the last 20 years, PEPFAR has expanded to support more than just ARVs. To control the HIV epidemic in Tanzania, PEPFAR supports the right mix of prevention, care, and treatment. Today in Tanzania, with the support of PEPFAR, the situation has changed. Now, there are 1.7 million people living with HIV and 1.5 million are on life-saving antiretroviral treatment. The number of new infections dropped by over 58% since 2003, and the number of deaths related to AIDS dropped to the historic minimum of 29,000. PEPFAR's investment in Tanzania have had an impact beyond the scope of HIV, building a foundation to support the whole national healthcare system. Tanzania is racing towards HIV epidemic control and has made great progress towards the UNAIDS 95-95-95 targets by 2030. Together with partners, PEPFAR is focusing on children, adolescent girls, young women, and key and vulnerable populations whose progress lags behind. Now PEPFAR must reimagine itself to focus on health equity for priority populations and sustainability of the program in order to end HIV in Tanzania.